hypermobility means loose muscles, it's all about connective tissue. Find out what it means for you. So in this video, I'll be answering some of the questions that have to do with your muscles and joints. And these are questions like, is hypermobility about loose muscles or connective tissue? Why do hypermobile joints crack more often? Does hypermobility worsen over time? How long does a hypermobility flare-up typically last? Great question. So let's begin. Is hypermobility about loose muscles or connective tissue? Hypermobility is a connective tissue disorder. It's not just loose muscles. It has to do with connective tissue. So connective tissue is what allows your body to have the shape that it has. When I say your body, let's think about your organs, the shape of your heart, the shape of your, I don't know, anything that you can imagine. That's the shape that your blood vessels have, your nerves, your soft tissue. All of those are relying on connective tissue to have the shape that they have. It is when your connective tissue protein called collagen is faulty, and then this impacts the integrity of your connective tissue. That changes the shape of the organs, your blood vessels, your nerves, as an example. It's more than loose muscles. In fact, most often people don't think about their muscles being loose, rather tight, which is a whole different video that I've done in the past. If you have not subscribed to the channel, this is a good opportunity to do so, so you don't miss on these videos that I basically do throughout each and every week. The next question is, why do hypermobile joints crack more often? Hypermobility involves more frequent joint cracking or popping as a combination of anatomical and biomechanical factors. Joints tend to crack because joint capsules and ligaments are looser, so the bones within the joints move around more freely, causing the cracking sounds. There is more increased range of motion, and the joints are more likely to move past the point where a typical person's joint would stabilize. So when the joints move back in place or shift their position, it can create that distinctive cracking or popping noise. The cracking noise is actually from synovial fluid and gas release, which are to lubricate and cushion joint movement. When a joint is stretched or manipulated, like it can happen with any hypermobile joints, gases dissolve in the synovial fluid, which are nitrogen, oxygen, and carbon dioxide, can form bubbles that can pop, creating their cracking sound. It can be from cartilage wherein minor instabilities that cause friction, producing cracking or popping sound during movement. Finally, it can be from muscle imbalance and weakness, which then allow the joints to move out of alignment more easily, causing cracking sounds. Most of the time, this joint cracking isn't painful and doesn't indicate a serious problem, though it can sometimes signal that the joint is under stress. So now you may wonder if hypermobility can actually worsen over time. The good news is it depends on what it is you're doing today going forward, that the answer changes depending on that. For example, if you're doing nothing about your hypermobility, meaning you're not learning how to stabilize your body, you will have that excess wear and tear, more stress, and of course things will be basically not looking as brightly in the future. The good news is that there are things you can do today and understand what your default movements are, catch yourself short of communicating and basically committing the crime, and then know what to replace them with. That's why it's so important to get to know your body, understand the principles of movement, and understand how to manage your tendencies. This is an ongoing awareness that we all have to do, hypermobile or not. The difference is that with hypermobile individuals, the level of enthusiasm to learn is high because when it doesn't happen, the level of pain and discomfort is a little bit higher, or maybe a little bit higher. So what happens when the body is stressed and you are hypermobile? That's a good one. We all have the flare-ups, hypermobile or not. It's just that you will have that flare-up, which takes us to the next question. How long does a hypermobility flare-up typically last? That really depends on a lot of factors, and it's very much individual based. The more stress the body is under, the less measures are taken to de-stress. The body over time will basically have to deal with it, so it has a lot more negative impact on the body in that situation or in those situations. That just means that the body's flare-ups going to last longer. There are factors like fluid intake, electrolytes, rest, and sleep that impact the flare-up directly. This is not a hypermobile thing. This is for everyone. Everyone. And all of those factors impact everyone's negativity, and they need to be addressed as a continuous effort. That kind of makes sense, right? So bendy or not, if you're not sleeping well, that's going to impact you. You will have flare-ups. Flare-up is not a hypermobile thing. If you have not subscribed to this channel and are not following us on social media, you may want to do something about it now. It's a good idea to go ahead and take care of that right now, so you have that continued feed of information to better understand your hypermobility. If you have any questions, or if you need help with navigating your path ahead, make sure you contact me, and until next time, take care.